welcome this evening to Basic Sectional Matrix Technique. This webinar is designed for dentists or expanded function dental assistants who are new to sectional matrix systems or are struggling with the system that they've employed in their office. So we're going to start with some very basic stuff and work our way through to hopefully help you be more successful with your product. First of all, our agenda here this evening, just a brief introduction. We're going to talk about probably one of the most important things if you're getting started with the sectional matrix system is picking the proper first case to tackle. So we're going to go through what is in a kit and the functions of each of the different parts of the kit. Then we're going to, on a typodont with live video demonstration, we're going to go through a basic MO procedure very slowly and methodically and talk about some of the tips and tricks that will help you avoid some of the common pitfalls when you're starting with a sectional system. I did just get in yesterday. It was kind of serendipitous that we got in yesterday a nice case that is a MO that we're going to be looking at utilizing the new Garrison Fusion sectional matrix system. Just came in yesterday's real nice case demonstrating what would be a good first case for you. We'll take a few minutes then in review and then open things up for questions from all of you folks. This event this evening, it's a very informal. We're going to take our time, like I said, and work our way through things. You can be typing in questions in the question box as we're going throughout, and then we'll tackle those at the end. Love the questions, so please jump right in there with lots of questions because that's the best way to learn, and we can hopefully be the most help to you if you're asking some of the challenges that you are particularly facing. We're not able to provide CE yet. It's something Kendall actually has submitted all the paperwork and stuff for, so we're hoping that this fall we can start offering these and provide some CE with it. Our format will have to change a little bit, but certainly it'd be nice to be able to pick up a credit or two by participating in these events. My name is Kevin Wahlberg. I've been here with the company for over 18 years, approaching 19 years now, and have had a real great experience here traveling all over the country, all over the world, presenting the Garrison products and techniques to literally thousands of dentists. It's kind of interesting right now that there is no place that you can go on the planet, no continent that you can travel to, including Antarctica, that you cannot find Garrison products. So we have a friend of ours who contracts with some department, some governmental department that runs McMurdo Station down in Antarctica and brings our products down there to treat patients during the Antarctic summer months. So anyways, again, Kendall here is helping me. If you have a question, you can feel free to submit those to is it the gds@garrisondental.com email address that we have posted on the screen. You'll see that a couple times this evening. But absolutely, if there's something we didn't quite get to, you can ask us questions that way as well. So we do have, to let you know, a couple more events that are firmed up anyways for the immediate future. We've got an event coming up in August 15th, where we're going to be talking about adjusting and polishing chairside and intraoral zirconia and lithium disilicate with our EZR product. So those tough materials require some special handling, and we've got some products to help you out with that. We're doing something a little different in the September webinar. That's going to be kind of an open thing. So we're calling it Ask Garrison. We'll be sending out email solicitations for you to submit questions or techniques or products that we carry that you want to see in more detail, and we're going to run down through whatever you folks want to see. So again, please join us for those events as they come up. So right now, let's jump into and talk about first cases. What makes a good a good first case. One of the important aspects of that is to not select a case that is maybe a very tiny conservative type of a preparation where the contact has not been broken. When you're switching from using a Toffelmeyer matrix system where you can kind of floss those bands down between an existing contact, that's not something that you can do with a sectional band. So the preparation needs to break the contact. So in fact, the case that we're going to see from Dr. Gary Alex a little bit later, it's a really good example. It's a replacement of a failed restoration. It's a nice size, things are wide open, easy access, and it's not going to be difficult for placing the bands. Now conversely is you don't want to go too big. You don't want a big blown out MOL or something like that, because there are some technical considerations when doing a wide prep like that. So start with maybe an amalgam replacement where it's not past the line angles and but yet the contact itself has been broken. And one of the things you don't want to try to do is jump into a real deep restoration. Again, there's some special considerations. Those are topics, the wide preps, the deep preps, multiple tooth restorations. We cover that in another webinar called Advanced Sectional Matrix Techniques. There is a recorded version out on our YouTube channel, and we probably will offer that again sometime in the near future so that we can do some live demonstration on typodonts and so forth, so you can see how to tackle some of those tougher cases. So again, on a first case basis, don't do an MOD, don't try to do back-to-backs or a whole bunch of rings and a multiple tooth restoration. It's just going to compound the difficulty level and make that first case very frustrating for you. So we want, good way to start, again, nice easy MO, wide open contacts, and just keeps things a little bit more simple. This is the newest version of our system. Of course, we've been doing this for a little over 20 years, and your kit that you have may not be this exact one. This has only been out for a few months now. Contents might vary depending on the kit that you purchased from us. This is a fairly complete kit. It's got all the various types of wedges, rings, instruments, and so forth in there. But perhaps, the material that you have, let's take a look at some of these older materials here. We've been doing rings for a long time, so maybe the rings that you've got that you haven't started using yet might look something like those. The technique for these types of rings is very similar to what we're going to take a look at here this evening. These real thin wire-tined rings, the technique there is a little bit different. I'm not really going to cover that here this evening. But your technique on the this style of ring will be similar even if you're using a, let's say, a Paladent Plus ring, a Trident ring. There's some material out there from Dr. Clark, BioClear, I believe they call that. It's got a similar tip design as far as the fitting over the wedge. That's what's common between the systems that I just mentioned, is how they fit over top of the wedge. Your bands might be a little bit different. See, these are some of the older styles of the matrix bands, the original ones from back in 97 and 98, and then up to the newer coated matrix bands. We'll take a look at the specifics of the fusion bands here so that you can identify those easily. So, but whatever the material you have, the technique is fairly similar. So we'll get all the old stuff out of the way here. Let's take a look at the new stuff. The separator rings in the fusion system come in 3 flavors. The difference between the blue and the orange is the height of these tips. You see how the blue one is a little shorter, the orange one is a little taller. There's a couple reasons for that. The first is if you've got a shorter tooth, this one is going to provide a little bit more intimate fit. Taller teeth, of course, you'd go with the orange one. The functionality is the same. If you are going to do an MOD, you'd put the blue ring on first on the mesial and the orange one on the distal. You can see how the difference in heights and the angulation allows them to be easily stacked for those types of restorations. So, but in an MO case like what we're going to do this evening, there's really not a lot of difference there. You could use either one of them quite successfully. Now the green ring is quite a bit different. It's kind of a specialty item, and you would get into this when you're doing a restoration that is a lot wider, where it does extend past the line angle. We can show you on the type it out. I've got a tooth prepped out that way, and you can see where that would come in handy. So this one you're not going to use as much, depending upon your patient base and whether you're doing those types of restorations on a regular basis. The blue and the orange are going to be your workhorses. So the function of the ring is to help adapt the matrix band to the tooth and is the primary separation force to help you achieve that nice tight contact. So you can see, particularly on the blue and the orange, see that little white area right in the middle of the blue on the tip. The plastic, that PEEK medical plastic, extends all the way through the silicone there so that it engages more deeply between the teeth to help drive those teeth apart, create more separation. The plastic on the back of the ring aids in the strength of the ring, the amount of separating pressure it's producing, and the longevity of the ring. So that's why that is there. It's not just a cosmetic thing, it is functional. The colored portions on all the rings are silicone, and that helps to adapt that band to the tooth again. So let's take a look at the matrix bands, and we'll talk about how to pick the proper matrix band. The typical kit has 5 sizes of bands in it. There are 2 with subgingival extensions. The blue and the kind of burgundy-ish red here have subgingival extensions on them. If you do have some deeper caries that you're dealing with, again, don't do that on your first case. There are 3 sizes without the subgingival extension, and selecting the band it really comes down to what is the height of the tooth. I can't say that, this is the molar band, you're going to use this on every molar. Well, if the molar's a little shorter, you'll do the mid-size band, or if it's really short, you might use the gray band. You want to match the height of the band to the height of the occlusal margin of that tooth. You don't want to have one that's far too tall. What happens then is you have a tendency to overfill that, and you have to then of course trim all of that back again. You're going to mess up your marginal ridge. You might have a little initial occlusal interference until you get that trimmed down. So you don't want to go too tall. Too short, of course, you're going to place your margin too low, or you may actually build some composite up over the top of the edge of that band, causing it to be locked in place. The bands of many of the sectional matrix kits out there today are curved in 3 dimensions. You can see these have quite a dramatic buccal lingual curvature, as well as the gingival occlusal curvature built into them, and again help recreate the anatomy of the tooth. The fusion bands with this full curve design, they are a little bit longer than some of the old ones. If we were to squash that one flat, and this one is fairly flat. You would see that the new fusion bands are longer. That's beneficial when you have a wider prep. You have a little bit more matrix material to wrap around the tooth. So that's the reason for that. So all of these are dead soft. One of the benefits of the full curve bands, and you'll find this with other brands as well, is they are a little bit more durable when you're placing the band. The flatter, older style matrix bands, because there is not as much curvature, they're a little more they're delicate. They're more delicate. They're made out of the same material, but because there's not as much curvature, there's not as much structural rigidity to them. So as you're placing them, if you get caught on something, you can bend that fairly easily. A little less easy with the full curve style bands, and of course they have a little placement tab on them as well. The other thing that comes in most of the kits are the wedges. This is the Fusion wedge. The color again corresponds to the size of the wedge. I can tell you simply, if you look at the information on refill purchases, blue is the #1 used size. Again, I can't say, you know what, you're going to use a blue on every molar, or you're going to use a blue on an interior. The blue it depends on the size of the interproximal space. You want a nice snug fit. You don't want to over wedge, but you want it to be in there snugly enough to seal up the bottom of that box. You want that band held firmly against the tooth. So that is something that you'll develop and probably have just from using wedges and other procedures, just a feel for, you know, what is the right size for, just by looking at the interproximal space. You will find that if the wedge is a little bit loose, you probably are going to want to step up a size, because you want to make sure that the box is sealed properly. And the little fins on the Fusion wedges, these look really aggressive, especially when you see them blown up on the screen like that. But that's a soft silicone type material on here, so they flex as the wedge goes in and then help prevent that wedge from backing out. And the little additional flex that's generated by the fins allows for really good adaptation if there's like a root concavity or something along those lines. Now, the Fusion kit that I have here this evening does have some of this product in it as well. It's called Fender Wedge. The Fender Wedge is used to pre-separate and protect the adjacent tooth when you're cutting the prep. It's kind of it's one of those things, some people really like them. Dental students love them. That's what these are for, is to, if you do have a restoration that you don't think you're going to break contact, this is a great product to use. Slide it in before you start to prep the tooth, and the color again corresponds to the thickness of the wedge portion. The wedge portion on the bottom is thicker or thinner depending on the color, and you want the wedge portion to be what is holding that fender wedge in place. You don't want the blade to be the only part that is engaged. What would happen then is when you do break the contact, if the fender part, the metal part, is all that's holding it in place, you run the risk of having this getting flicked right out of the interproximal space by your handpiece. So make sure that it's the wedge portion that is firmly engaged. What this will do is it'll help to loosen those periodontal ligaments while you're prepping the tooth to aid you in getting some additional tooth movement. That will help during matrix band placement, give you a little bit more space to work with. Again, particularly beneficial if it's a very conservative prep. So that's all the little bits that come in the kit. There are some instruments that come in. Now, your instrument selection will depend on the kit that you buy. Virtually all the kits that we currently have available, and just about every kit you buy from anybody anywhere is going to have the appropriate ring placement forceps with it. If you buy a kit, I don't care if it's a Garrison kit or a Paladin kit or wherever you get it from, use the forceps that come in your kit. They are, whoever's kit it is, they are designed to fit the rings from that brand the best. So you want to make sure that the ring is securely held in the tips of the forceps. There's a lot of spring tension. Again, it doesn't matter which brand name you're using, there's a lot of spring tension in these rings, and you want to make sure you have a very secure grip on them when you're placing them. So this is the new Fusion ring placement forceps. It is forged, and we'll forge stainless instead of a stamped stainless. It's very rigid and does a great job making these strong rings easy to place. The kit that we're looking at tonight does have one of our multifunction composite instruments. We'll talk about that a little bit as we do a demonstration. And then this kit has the band placement and removal forceps. Different kits have, for instance, like the Trident and Paladin kit, they have a pin system that they use. I'm not a huge fan of that, just because you can get hung up on the pin can get caught in the matrix band holes and dislodge the band when you're trying to get it in place. So these are a nice curved instrument to aid in placement. So, but again, if you have a Garrison kit, you may or may not have these different parts with it depending on what you purchased. So let's get a Typodon in here and start talking about doing a restoration. So this Typodon has quite a few different preps on it. We use this one when we're talking about advanced sectional matrix techniques, and we're doing back-to-backs and MODs. The wide embrasure here, we'll take a real quick look at that tonight so that you can see how the green ring would apply there. But we're going to do this MO on that premolar there. Again, I'm talking basics here. I don't want to insult anybody's intelligence, but there is a right way and a wrong way to grab one of those rings and to make it easier for you to place. We're gonna take a look at that here in a minute. Even what is up and down on a matrix band. The old bands, without the tabs on it, it was a little bit more difficult to tell. The new bands from the various manufacturers that have the tab on it, the tab always goes on the occlusal side. I mean, that's fairly obvious, but I need to say it because we are talking basic technique here. So this particular tooth, this MO, I happen to know the best fit is going to be the purple mid-size band. I think that's 5.5 millimeters tall in the gingival occlusal direction on the body of the band, and that's going to put that marginal ridge at a nice spot for us. So I'm going to use the band placement forceps that came with this kit, and just grab that little tab. You can, if you prefer, you can grab the band out on one of the buccal or lingual edges of the band. That is not going to be in the restoration area, so it doesn't matter if you crimp it a little bit or not with your forceps. And of course, that's what the tab does. It allows you to grab right in the center for an occlusal placement without messing up that band in any way. So, and by the way, just so you know, the bands that you see on the market that are colored like this, that coloring is in the Teflon family of chemicals, and it prevents the bonding agents in composites from sticking to the bands. Now, some types of bonding agents bond fairly aggressively to stainless steel, and that can make the removal of the matrix band very difficult. Some of the newer stuff, or if you're going back and maybe you're doing a separate bond etch, you know, all those as a different a different chemical, separate chemical, those, it's not as much of an issue. It's kind of those all-in-one bonding agents, etchants, and whatnot, all in one that have a tendency to want to bond to the stainless steel. So now, when you're placing a matrix band, it does have the different curvatures in there, so you don't want to necessarily try to drop it and push it straight down. What can happen is the bottom edge of this is very thin and sharp, and it will catch on one of the edges of the prep, and as soon as you put downward pressure on it, you'll start to crumple the different parts of the band, and as soon as you do that, your best bet is throw that band away and start over again, because it's difficult to get it smoothed out again. So what you can do is, as you're dropping it in occlusally, is give it a little bit of a rocking motion and just kind of roll that gingival edge around the prep. So I'm just going to do that and just kind of roll it around the prep a little bit. As you see here, I'm dropping it in place, and then make sure it's seated down gingivally all the way. It's a really bad idea to place wedges with this particular instrument. The tips are designed to hold really thin material, and if you grip a lot of wedges have like a gripping block on the end. If you grip that block and squeeze too hard, you'll bend these and make them worthless for matrix bands. So don't put wedges in with that. I'm going to use a little dressing forceps. I happen to prefer for that job. Hemostat works great too, a little curved hemostat, mosquito hemostat, some people call that. So the wedges, they do have a little gripping block on the end to help make sure that you've got a secure grip on the wedge. Wedging from the buckle or lingual, there's different thoughts on that. I feel that the best is to wedge from the direction that the prep tends towards. So for instance, this big wide prep back here, you would wedge that from the lingual, because you want the biggest, fattest part of the wedge helping to support that matrix band where the wall is missing here. This particular prep that we're doing here this evening, it really doesn't matter which direction you're going to wedge from. It is very beneficial, in fact almost a necessity, to put a finger on the band as you're driving the wedge in. Unlike a Tafelmayer band that's going all the way around, because this is segmented like this, I'll do it without holding the band, you'll see what happens. I just shove the band right through the prep that way. See how that's just dislodging that band, and it's pushing it around in all kinds of angles and whatnot. So definitely either you or your assistant hold a finger on that band while you're wedging, and wedge firmly. You don't want to wedge too hard. We're going to take a look at a tooth that I did where I crammed the biggest wedge I had in there and then burnished it like crazy, burnished the matrix band like crazy, and it creates a giant overhang. We'll take a look at that in a second. So now this is ready to place the separator ring. Again here, we can swap out. I'll show you the blue and the orange on that tooth, and you can see it really doesn't particularly matter which one you use on this restoration. The Forceps with the Fusion kit, they've got this little hook in the tip. You want to make sure that you're engaging the ring down into that crevice, not accidentally getting it out here on the tip. If you get it on the tip, it's gonna, it's either gonna pop in or it's gonna pop out. So you want to make sure it's engaged all the way down in there. The ring itself, you're going to grab it right at the metal part. Now, when you open it, it might slide back a little bit. That's okay. It's not going to go anywhere. And it can't certainly slide forward too far because you've got the plastic on the back of that to prevent that. So right where the metal is, grab that. A word of warning here as far as getting your rings to last as long as possible. Again, it doesn't matter whose rings you have. Don't have your assistant put the ring on the forceps, crank it wide open, and leave it setting on the tray waiting for you to do the procedure. Having the ring in a wide open position like that can start to stretch the rings out. So just have the assistant leave the ring at rest on the tray, and you pick it up with the forceps when you're ready to place it. You only want to open that ring far enough for comfortable placement. You can, with these forceps, you can stretch these things just about straight if you're not careful. So you just want to open it enough to allow you to place it. Now, you'll notice that I have the tips of the ring facing away from my hand, and I'm not trying to put the ring in a reverse position like this. That is very difficult to do. You'll get very frustrated quickly if you have the tines of the ring facing your hand when you're holding the forceps. That's going to create all kinds of issues for you when you try to place it. The body of the ring should always be facing the anterior of the mouth like this. Even when you're doing MODs, that's why they're designed to stack over top. You're not going to put two rings in a opposing position like this. There's not enough room most of the time in the posterior of the mouth to set that ring in there like that. So always have the ring facing in this direction. The ring tines on a lot of our modern rings now are carved out here on the bottom to allow them to ride right over top of the wedge. That is such a nice improvement. That came about, maybe 6-8 years ago. Folks started doing that, and boy, does that make placement a lot easier. So now, during placement, common misconception is to come in and try to push it straight down. Well, look what happens here. If I come in and try to push this ring straight down onto that restoration, the tips of the ring grab that band. They'll grab that bucker or lingual edge of the band if I'm not careful, and as soon as I put a little bit of pressure towards the gingiva, I'm going to crush the band. So what we're going to do, I'm going to try to tip this up a little bit to see better. Not like this, straight. We're going to come in an angle. I'm going to tip this up a little bit. I'm going to come down into the band, and I'm going to push the band out of the way with the tips, and then I'm going to rotate it down into a nice position. So don't come straight and try to push it straight down. Come at an angle, push it into the band, bend that band out of the way, and then place it down on there. Make sure it's seated down as far gingivally as possible. Again, that's to help the ring, again, whatever matrix brand you're using, that's going to help the ring retain on the tooth by having it as far gingivally located as possible. I'm going to switch out here a minute so you can see. I'm going to put the orange ring on here just a second. So you can see how where this is riding on the tooth, it's not quite all the way up to the marginal ridge. I'm going to put the orange ring on quick a second so you can see how that one fits in that position. Oh, grabbing something there. There we go. Okay, let's tip that up. And you can see how that rides up a little higher here on the tooth. That's probably a better bet for that location. What that does for you is it helps higher up on the tooth. The silicone will help adapt that band nicely, intimately to the tooth to prevent any flash. So the blue ring, a little bit lower on the tooth, maybe not the best choice for this, could allow a little gap in here because the ring is not engaged all the way up towards the margin. So and once you have the ring in place, you can bend that tab over the adjacent tooth out of the way. And before you start to do any bonding, etching, and all that good stuff, is you want to come in here and you want to tug, not burnish, you want to tug that band over. That's a great thing with a sectional band, is all you have to do is give it a tug because it'll stay where you put it. A circumferential band, when you tug on this side, particularly on an MOD, it this side, because it's wrapped around the tooth, wants to pull the band back. So the band has such a tendency to spring back, so you're burnishing it and you're scrubbing hard on it with your instrument to try to actually stretch the metal out to keep it in contact with the adjacent tooth. Here, just a nice tug. We're going to take a look here quick a second in the tooth. I told you that I purposely did the opposite of that. You can see this nasty overhang that I created, and that was simply an aspect of wedging very aggressively and then burnishing very aggressively and actually stretching that metal over the top of that too large of a wedge. Now I've created this big distension here and a massive overhang. So that's just a word of caution there, is the burnish, the movement of that band to the adjacent tooth is critical to the success of and getting a tight contact, but over burnishing and over aggressive wedging will create some issues for you. So, and again, the instrument here that I used was this multifunction composite instrument. You can, tap the first increment of composite in there. You can carve the occlusal contours with that, and then two orientations of thin blades if you're going to do some sculpting, carve the marginal ridge a little bit or whatnot with that. Certainly not a requirement, but a pretty handy little instrument. It's one of those things that people either love that instrument or they hate it. So, but that goes with anything, right? You either love it or you hate it. So let's take just a super quick look at putting the green ring on this wide prep. Don't do a case like this as your first one, but I want to show you this because it is something that is absolutely unique to the Garrison Fusion system. Is a ring specifically designed to tackle these restorations. So same type of band placement. I used a little bit bigger band. I used the green one. That's the what I would call the tall molar. Again, I'm going to wedge that from the lingual, holding a finger on that while I wedge. And now putting this really wide tined ring on here, and look at how that helps you recreate that cusp. So that's quite a significant step and improvement of ease of doing that type of restoration. A good idea, this is bigger prep here, is a good one to demonstrate this. Whatever restoration you're doing, when you have the ring in place and you've tugged that band over to the adjacent tooth, it's a great idea to take an Explorer or some other, like a real thin bladed instrument, and just, get your mirror in there and look down in there and make sure that you've got that band sealed up nice on that, at the very bottom edge of that prep. And you can see here, this one's got a nice seal on the bottom of the box there. Sometimes if you've moved the band a little bit when you're wedging or putting the ring on, you'll look down in there and you may not have the band deep enough. So double check that before you start in on the actual restoration itself. Just make sure that you've got a good seal down there in the bottom of the box. So we're going to switch back over here quick a second to some slides, and we're going to take a look at a case. Like I said, we just got this in yesterday from Dr. Gary Alex. You may be familiar with that name. Dr. Alex has done a tremendous amount of lecturing and writes all kinds of articles, does a lot of traveling. And he sent us this case yesterday, and I think it's a great example of a good first case. So on this, you can see on the radiograph, we've got some decay down towards the gingival underneath an existing restoration. You can probably tell it looks like it might be a composite restoration because it's not quite as bright, but I don't have the radiographical skills to be able to tell you what that was done with. But so let's go to the next slide, and he's got it prepped out here. And he's using red matrix band, the smaller one with the subgingival extension that we looked at earlier. Look at how that prep, it doesn't extend too far to the buccal or the lingual. Actually, that's a DO. What am I talking about? Doesn't extend too far to the buccal or the lingual, but yet plenty large enough so that the contact was sufficiently broken to make band placement easier. It's a great example of a first case. Obviously it's not his first case. He's done, jillions of these things, but a great one for you to start with, something similar to this. So he's got it prepped out, got everything in place. You can see down, you can just about see that interface between the band and the bottom margin of the box there. It looks like it's in there sealed up nice and tight. So, and now he's laid a couple increments in there. Again, I'm not a big proponent of any particular method for filling these, whether you build it up in increments or you're using a bulk fill, sonic fill type device. That's not something that I can really comment on one way or the other. There's a lot of schools of thought in either direction there, but you can see how he started to build that up. I think our next slide shows right after he's taken everything out, he's starting to do some adjustment on there. You can see he's got a nice broad contact, nice looking restoration, and he was kind enough to provide us with a post-op x-ray. The next slide, where you can see how he's gotten a nice deep broad contact. If you're familiar with looking at radiographs of Toffelmeyer restorations, that is not how they typically look. The Toffelmeyer restoration is so often a big food trap, thin contact right at the marginal ridge, a very friable contact. You have to worry about chips and fractures right on that marginal ridge. So this obviously is going to be a nice durable restoration for this patient. So let's quick talk about cleaning and what to do with these materials to keep them going as long as possible. The matrix bands and wedges, of course, are disposable items. You're just going to toss those. The rings themselves, they do sometimes get some adhesive or bonding agent or composite stuck to them. That's not a big deal. It will really help if your assistants clean these thoroughly before they sterilize them. Once they go through the autoclave, that stuff's on there forever. So clean it first. Use a soft brush, warm water, and soap. No strong chemicals on the rings. It's not recommended to put them in an ultrasonic cleaner. We do torture test them, just about doing anything possibly wrong that you could do to them. They hold up pretty well, but any chemicals on there certainly over time is going to have a tendency to degrade the plastic. So warm water, mild soap, plastic brush. And then the same with any of the instruments. Make sure that they clean them thoroughly before they autoclave them. Instruments like the titanium nitride coated composite instruments, it's imperative, if they put them in an ultrasonic cleaner, to put them in a cassette. You don't want that titanium nitride coating rubbing against other metal instruments in the ultrasound that will wear through them. So, and again, to keep them going as long as possible, don't overstretch them during placement. Leave them on the tray at rest until you pick them up for placement. You'll get a longer life, and that goes for any sectional matrix ring regardless of the name brand on it. So let's take a quick review here, and then we're going to jump into your questions. pick that first case carefully. You want to make sure that you get off to a strong, confident start. Once you've got a couple cases under your belt, then go on to an MOD, or if you've got the fusion system with the green ring, a wide prep will not be as difficult as it can with some of the older systems. The wide preps can be quite a challenge with some of the other stuff. So once you have the ring in place, it doesn't hurt to check your wedge. Like I said, use an explorer on the bottom of the box to make sure that that band is up tight, and you can take your like the dressing forceps that I was using, or your hemostat, check the wedge and make sure that the separation caused by the ring hasn't loosened up the wedge. You will sometimes find that, depending on the mobility of the teeth, you might find that the ring has moved the teeth significantly enough that you want to step up a size in the wedge to make sure that you've got a good seal at the bottom of the box. So, and then lightly burnish the band, just a tug, not an aggressive scrubbing back and forth motion. You'll put lines in the band that will end up in your restoration, and you can also create overhangs like I showed you. So, and overall, super important, if you are having difficulty, call us or email us. If we can't answer your question on the phone, we can do a live one-on-one discussion webinar type thing like we're doing now. And certainly if you're in one of the cities that we're traveling to for trade shows, stop by the booth. We have very qualified personnel that would be just happy to spend as much time as necessary walking you step by step through everything. So what we're going to do now is Kendall is going to take a look at what we have for questions.
What do you think about the compressive strength of molar composites as opposed to amalgam? I'm concerned about the strength of composites in general.
Well, I think that 20 years ago, that was definitely a greater concern. The composites, we had a lot of trouble with sensitivity back then. I think the research has shown that a lot of times that was due to not getting a good bond, allowing some hydraulic pressure to take place underneath the restorations. I think if you're utilizing the current techniques properly, those issues have been solved. The new materials, some of the hybrid materials, are very durable. I think that there's a lot to be said for having a bonded restoration like that now versus 20 years ago. And this stuff just gets better all the time. They're coming out with just fantastic materials. Every year seems like there's some new materials with improved characteristics. So I would encourage you to check out some of the more recent literature on that particular topic. I think you'll find that no, it's not going to be as strong as amalgam, but boy, that stuff is really getting good, and the aesthetics are such an improvement.
One doctor has a tip that if you can see the wedge at all from the occlusal surface, that it's not tight enough. So that's your, chance to.
That's a great point, and that's a great thing about the brightly colored wedges. You can see them down between the band and if the band isn't down deep enough, you can see that wedge in there. So,
how can I watch the advanced technique webinar?
If you go to YouTube and search on Garrison Dental Solutions Advanced Sectional Technique, it should bring you right to that video.
And we have all of our webinars up.
Yeah.
Could you use this band system to restore distal of cuspids, especially maxillary?
Well, let's take a look. I don't have a prep exactly like that, but we're close. I'm going to put the band in backwards. You know, you would put the band towards the MO on that premolar, but what we're going to do is pretend that we've got a preparation on that side. So slide the band in, just like we did before. I used the shorter band because, as you see, let's see if I can get that angle. You can see that shorter band is plenty tall to cover the area that would be removed in the preparation. And I'm going to guess that the orange wedge will be sufficient here. Yeah, that feels pretty good. So you would wedge that just like normal. This is a case where I think the blue ring is absolutely called for. It's a little shorter. Now, that is a difficult spot to grip onto. This is holding on pretty well. Some types of rings do not grip there very well, so you can see that we could in fact restore that pretty effectively. You know, we've got a good the band is nicely contoured. I didn't flip that little tab out of the way. Let me get that out of the way. Yeah, I think ultimately, yeah, I think you could restore that without too much difficulty. I'll have to prep one out so that I've got that prepared for the next time someone asks that question, but I think that's totally doable.
Are you getting as tight a contact with your composites as with amalgam?
The complaint that we get with our last two systems, the Compositite 3D XR and the Compositite Fusion, is more frequently than too light a contact, we have people say it's too tight. That the separation generated by the combination of wedge and ring is significant, and if they are using or wedging fairly aggressively, that contact can be painfully tight, and we actually have brought in a product now so that folks can lighten those contacts if they're too tight. So again, you're getting separation from two sources with these now. You're getting it from the wedge and from the ring. When you're using amalgam, you're wedging the bottom of that band, but then you're packing the amalgam in there, and it's the force of packing that gives you that contact. But yet we've got two things that are generating that for you here.
What are the steps for back-to-back MO and DO restorations?
If I slide this up, now I have seen cases, we've got some cases that folks have sent us doing all of this at one time. I think that's a pretty risky thing to do. In that that's a lot of hardware, you've got a lot of moving parts in there. In this particular circumstance, I think the conservative way to do this restoration would be to do the MO first and then perform the MOD. Placing back-to-back matrix bands, I can drop them in here a minute to kind of give you an idea of what that feels like. Get a few bands going here. These little bands, here's a little tip for you. When you grab a matrix band out of the box, I highly recommend that you take that band and drop it on your tray, because that will separate them. It is very difficult to tell oftentimes if you have more than one matrix band at a time, and then of course you have double the thickness that you're dealing with. So let's get a couple of these bands in there, and because I want to show you. I'm going to get that in. Placing, even getting the second band in is a little That's a little bit of a bugger. Again, depending on how wide open the contact is, see, I gotta do a little back and forth on that to get it down, and use an extra finger in there to even get the band to seat down. And I'm gonna put the MO in there. Okay. Once you've got the bands in, you're going to wedge them all off. Finger again on top. Let's do this guy here. I'm going to put the mesial ring on first. Grab this blue one over here. Blue is the shorter one, so we want to place that one first. Always place it on the mesial. Now, you've got a bit of a mess there that you've got to get in between. You've got to get in here and get the ends of those bands out of the way, all the way out of the way, before you attempt to place this ring over top. And your chance of grabbing an edge of one of those bands is significantly greater. And still, you're going to do them one at a time. You're going to get this tab out of the way. You have to be careful burnishing here. You don't want to burnish the one band too aggressively, because then you're going to encroach into where the normal location of the adjacent tooth wall would be. So the first restoration oftentimes is done without the ring at all. They'll do it like this. They'll fill that, cure it, then put the ring on so that they can burnish, you know, against that adjacent restoration. So I would caution you against doing that. I think your risk of having a light contact or just getting frustrated with pieces moving around on you is greater than the benefit of the little bit of speed that you might pick up by doing them all at the same time.
One doctor wrote in and said that usually they would do the MOD first and then the MO, because it's easier to deal with the contacts. So that's an option too.
Yeah. You know, and I've seen on like quadrant, replacing a whole quadrant of amalgam where you've got you know, multiple MODs on one side. Is that it wasn't Martin Abel, Dr. Martin Abel, again a pretty well-known lecturing dentist, author. He had a concept that he called the anchor tooth. You know, he would pick which tooth he felt was going to be the most difficult in that quadrant. He would restore that first and then build all the other contacts against that using a sectional system like this. So again, some of those get quite a bit more involved, and we do have some good tips and recommendations on some of those more challenging restorations in the advanced sectional matrix technique webinar that's already out there. And we'll do that again here probably in a few months. So thank you so much for joining us this evening.